Welcome aboard, everybody. Hope you are feeling well. Hope you are doing well. Hope you are running as fast as is humanly possible away from the office of an MD if you are suffering with a chronic disease because your MD is not trained in how to interface with chronic disease and the skill set that the MD brings to the table in understanding how your chronic disease got there in the first place and what to do about it is unbelievably juvenile, completely ineffective, outdated, and yet, in the majority, it's the gifts that keeps on giving the conventional medical establishment. This in from Medscape. Brand new study published in Medscape or reported in Medscape. The risk of type 2 diabetes rises with statin drug use. The risk of type 2 diabetes rises with statin adherence. This written by Miriam E. Tucker, July 17th, 2014. The risk of new onset type 2 diabetes rises with adherence to statin therapy, that's cholesterol-lowering statin medication, providing further confirmation of the previously reported link. However, the author says, the benefits of statins still clearly outweigh the risks. The benefits of statins still clearly outweigh the risks. Well, you know, if you say a lie long enough, people are going to believe that it's true, especially when you are the king of the hill and nobody can refute what you say because, remember, it is good to be the king. I want you to look at these numbers, though, because the devil is in the details. All right, here we go. Based on the data that they looked at in this study, the authors estimate that about 280 patients would have to be continuously treated with statins to get one case of diabetes a year. 280 patients would have to be continuously treated with statins to give one case of diabetes per year. Well, 1 out of 280, right? In contrast, another meta-analysis of 7 randomized control studies found that statin drugs decreased one major cardiovascular or cerebrovascular event. So statin drugs decreased heart attacks or strokes for 1 out of every 40 patients treated. Well, what about the other 39? What about the other 39 patients that were treated with the statins who got a heart attack or who got a stroke? And 1 out of 280, really? So it's only 1 out of 280 that are going to get diabetes, and 39 people, 39 out of 40 people who take statin drugs are still going to get heart attacks. I mean, those are horrible percentage numbers, and yet this is what the medical profession rallies around. This is what the pharmaceutical industry rallies around because they're lopsided, egomaniacal, intellectual cowards who have no understanding or appreciation of data. And when they do have an understanding and an appreciation of data, they look at it from their particular point of view. I cannot stress this enough. This is a very important thing to understand. This is perhaps the most important thing to understand. 3 important things to understand. Number 1, your body needs 90 essential nutrients in order to be healthy. You can't get those 90 essential nutrients from food. You must supplement in order to make your body as healthy as it can be. Number 2, there are 10 foods that need to be avoided like the flippin' plague. And number 3, your MD is not trained how to cure your disease. Your MD is only trained in how to manage the disease process with drugs or surgery. And here we go again, the gifts that keeps on giving, again, reported in Medscape, multi-specialty, medscape.com. No effect from acetaminophen in acute low back pain. The first randomized placebo-controlled trial of acetaminophen for patients with low back pain has shown no effect of the drug on the speed of recovery, pain, or many other factors associated with the condition. But, you know, medical doctors have been telling people for years, just take your acetaminophen, just take it. Just take it, folks. That's what you need, even though, of course, it increases acute liver failure. It is the most common cause of acute liver failure. Patients admitted to the hospital, and they take it for back pain that now it's been proven it has no effect for. And I'm the quack. I mean, isn't this, again, the very definition of snake oil? Medicinal substance that is supposed to do A does not do A and instead hurts you. I mean, isn't that snake oil? Well, acetaminophen, snake oil. Statin drugs, snake oil. And it gets worse. Leading cause of death in the United States, MD-directed medical therapeutics. Leading cause of bankruptcy in the United States, MD-directed medical therapeutics. Why would anybody continue to go to an MD with a chronic disease is beyond me. I think the reason that people continue to go is because they don't know there's another way. And when people go into a hospital setting, they're overwhelmed and they feel intellectually inferior. I mean, you just walk into a multi-million-dollar medical complex, and you're going to do whatever the doctor tells you to do because that's the vibe of the place. And it's a perfect setup. But what really gets me is that the medical doctors don't create a flack. 500,000 people died from Vioxx. 500,000 people died from Vioxx. Why wasn't there a million physician march on Washington, D.C.? I mean, haven't these people dedicated themselves to eliminating human suffering? I mean, if you were a member of the, UPS, and UPS trucks killed 500,000 people a year, wouldn't you go on strike or, do something? I mean, wouldn't you do something? Wouldn't you do something? You would, but your medical doctor does not, because your medical doctor does not have your back. Actions speak louder than words. And the stuff that the MDs do not do is 1,000 times more telling than the stuff that they do. And again, it all comes down to philosophical orientation and understanding. You would not go to a communist for get information on voters' rights, right? You wouldn't do that. You wouldn't go to a Democrat to get information on legalizing guns and gun use, right? You wouldn't do that. You wouldn't go to a Republican for information on welfare programs. You wouldn't do that, unless, of course, it was corporate welfare. But a person's philosophy is everything, and people in the United States, people in Canada, people in the European Union are completely unaware of the philosophical understanding that their MDs bring to bear in their investigation and understanding and treatment of chronic disease. If people understood the MD's philosophical orientation, they would follow my advice, fire their medical doctors immediately, and seek a more rational solution. Seek a much more rational solution. Now, it's very interesting. I alluded to this last Thursday on Metaphysical Thursday, or last Wednesday, I can't remember. But from a holistic point of view, the language of the symptomology of the body is everything to the inquiring mind of a holistic physician. The language of the symptoms of the body is nothing to an MD. The less that the patient tells them, the better off the MD feels. All the MD really needs to know is what part of your body is in pain, and then the MD needs objective diagnostic information, right? Urinalysis, blood work, stool analysis, X-ray, MRI, CT scan, right? That's what the MD leans heavily on, objective data. The MDs also lean heavily on autopsy, the investigation and examination of diseased and dead tissue. Well, there's information that you can glean from diseased and dead tissue, but the information that you're going to glean from diseased and dead tissue is going to give you little or no information about how to handle a living, breathing human being. So, because the MDs are reductionistic in their philosophical inclination, because reductionism argues if it can't be measured, it doesn't exist, because nobody's ever measured the soul, spiritual soul, vital force inside the human body, interfacing with the human body does not exist to the MD. If it doesn't exist, it doesn't exist. And this is why the MD is completely over the moon with everything objective and doesn't want to know anything subjective whatsoever. The MD is not concerned with the language of your disease. The MD only needs to know what part of the body is affected so that they can deliver a medication to suppress the symptom. The symptomology, the active symptomology, the very stuff that your body is producing, which offer the clues to a cure of the problem, the MD doesn't want anything to do with because they adhere to a non-vitalistic philosophy. The human body to the MD does not have the ability to fix itself. The human body to the MD is a bumbling bag of biochemicals ready to break. An evolutionary mistake. An evolutionary happenstance. Consciousness is a function of biochemistry. When the body dies, everything stops, it's lights out, party's over, your soul is a fiction, does not exist, there's no such thing as heaven, there's no such thing as life after death. Everything is here and now, and if you can't measure it, forget about it. Just forget about it. So, you'll have a child who has anxiety and panic attacks. The child has a difficulty concentrating. The child wets the bed at night. The child can't write straightly. The child can't memorize things. And you bring the child to the MD, and the MD does an entire battery of tests and can find nothing wrong with the child. There's nothing wrong objectively. The physiology is 100% intact. Everything's pumping out on all 16 cylinders. And yet, there's a problem. But the MD, because all of the objective stuff is okay, what do? They farm the child out to a psychiatrist. Because when you can't find anything physiologically wrong, but there are strong and persistent symptoms, it must be in the person's head. This is how they think. It's nonsense. And this is why you should abandon hope. The moment that you enter an MD's office looking for advice for how to handle and deal with a chronic disease, ladies and gentlemen, be forewarned. Fire your medical doctor now. They have nothing for you but expensive, ineffective, symptom-suppressing medical treatments that do not work. Stick around. I mean, when you're colorblind, and colorblind art critics just don't get it. Colorblind artists who don't know they're colorblind paint horrible pictures. They paint pictures, but they're horrible. So, the MD being non-vital, having nothing to do with anything, outside of what science can measure, looks at the human body and completely is not 100% not interested in the active subjective symptoms that the disease is manifesting, right? So you go to a medical doctor, you spend 2 minutes with the doctor, you tell them, my back hurts, or my left foot hurts, or my eye twitches, or whatever, and then it's off to the diagnostic discovery mill where they run up thousands of dollars of testing, and then they'll come back and you say, look, there's nothing wrong with you, but doctor, I have these strong and persistent symptoms. Well, I'm sorry, come back when they get worse. Or it's off to the psych house for you, right? This is crazy because the way that the symptoms manifest, the language of the symptoms is everything. So here's the deal. When your body is in a state of balance, it's in a state of balance and it is symptom-free. Health is defined as the ability of a human body to experience stress and remain symptom-free in a state of dynamic equilibrium and equipoise. Health is the ability of a living organism to experience stress and remain symptom-free in a state of dynamic equilibrium or equipoise. So, your body is in a state of health and you don't have any headaches, you don't have any aches or pains, you got nothing, you're good to go. Your body experiences a stress. Maybe it's not enough nutrition. Maybe it's crap in the air, crap in the water, crap in the food. Maybe it's a virus. Maybe it's a lion attack. Maybe it's tigers and bears. Maybe it's a bacteria. Who knows? Maybe it's a fight with your wife. Maybe you're getting married. Maybe you're getting divorced. Maybe you just won $10 million. Maybe you just lost $10 million. Stress is everywhere all of the time. So your body experiences stress, and if the stress is weak or your body is strong enough, the stress impacts the body, bounces off the body, and nothing happens. You have outmatched the stress. But if the stress is too much for your system to handle, the stress impacts the body, destabilizes the body, and the body automatically produces a symptom to manage being off balance. You see how that works? A symptom is your body's active manifestation. It is what your body is doing to deal with the stress that it has just experienced. MDs, of course, have no philosophical understanding of the nature and the relationship, the genesis of disease, or the relationship between symptoms and the disease process. They don't give a crap about this. So it is the MD's job to deliver a medicine to suppress the symptom. Now remember, the symptom was there as a self-regulating mechanism. When you suppress the symptom, the system falls further off balance and must generate another symptom somewhere else. That's how it goes. So the therapeutic intervention that the MDs bring to the table, symptom suppressive therapies. Also therapies that are designed specifically to, eliminate the arthritic knee, remove the infected kidney, remove the infected gallbladder, remove the heart, right? Cut the breast off, cut the other breast off, cut the prostate out, cut the tumor out. These therapeutics don't address the cause of the illness. The tumor is not the cause of the disease. The tumor is the result of the disease. So when you eliminate the tumor, guess what happens? The body falls further off balance and you get another tumor somewhere else. So you cut the right knee out, give a prosthetic knee, and a couple of years later that starts to fail and then the left knee goes. Because the therapeutic did not address the cause of the problem. Right? Now, every holistic medical therapeutic in the world delivers therapeutics not that suppress symptoms, but by paying attention to the symptoms, generate therapeutics, the intention of which is to push the system back into balance. Because when the system recovers balance, what happens to the symptom? It goes away. Voila. Holistic medicine in a nutshell. Now, why don't you know this? Why weren't you taught this in grade school? Why weren't you taught this in high school? Why weren't you taught this in college? Because the medical industry has been monopolized in the United States by the last 100 years by the pharmaceutical industry, and they don't give a crap about this. They think it's a fantasy. They think it's foolish, and they're wrong. It's kind of like we're all living in a Harry Potter novel, and there's the Muggles, and there's the witches and the warlocks. And they're completely two different classifications of human beings. There are the reductionistically minded MDs who've thrown the baby out with the bathwater, and all they want to do is drug the body, drug the symptom, suppress the symptom, eliminate the symptom, or surgically remove the symptom. And then you have the rational people who just want to support the body's ability to fix itself. Now, who are you going to go with? Tides are turning, things are shifting, the teams are going to their respective corners. Whose corner are you going to end up in? My corner, if you're smart. I'm Dr. Peter Glidden. Stick around. Canada is up next with Matthew. Hey, everybody, welcome back. Dr. Peter Glidden here, your steadfast advocate for health, welcoming you to watch the live stream. We're videocasting this even as we speak, thedrgliddenshow.tv. The DRGLIDDEN show.tv. Let's go up to Canada, eh? See what Matt's talking about, eh? Hey, Matt, what's going on? Matthew. Come on in, Matthew. Oh, Canada. Come on, Matt, I know you're up there. Come on in, Matt. No, Matt. We'll put Matt on hold and go to Richard in North Carolina. Hey, Richard, thanks for the phone call. You are live.
Yes, Dr. Glidden. Are you there?
Yes, sir. I am here live and in living color.
Okay, this is a call from my brother. He was diagnosed today with a condition called glossopharyngeal neuralgia.
Yeah. Yeah. And, so that means his tongue gets numb.
That's correct.
Yeah.
And he said he has excruciating, I guess sometimes he chew, cough, and swallow.
Yeah.
And it's like a bolt of lightning going through his body.
Yeah, okay. So are you an insider with me, Richard?
Yes, I am.
All right. So you want to send him, first of all, thank you for the support. And secondly, you want to send him a link to the webinar that I did on ringing in the ears.
Okay, ringing in the ears, okay.
Yeah, we might have called it tinnitus, Tinnitus, because, that's fancy schmancy doctor talk for ringing in the ears, or we might have just called it ringing in the ears. I can't remember. But in that webinar, I talk about what can cause this numbness in the tongue and the palate situation. We believe it's osteoporosis of the skull. It's just a different nerve. It's the glossopharyngeal nerve that comes out of the brain and that goes to his tongue. When that nerve comes out of the brain, it's got to go through the skull in order to get to the tongue, and it goes through a tunnel in the skull. And if the skull bone is healthy, the tunnel is clear and empty, and the walls of the tunnel have integrity, structural integrity. Mm-hmm. But if the body is out of minerals, which everybody's body is, the skull bone is going to be weak, the walls of the canal are going to be weak, and the canal will start to collapse, and then the body puts connective tissue in there to shore it up. And when there's funky connective tissue in there, it rubs up against the glossopharyngeal nerve, and that's what's causing the problem from our point of view. It's osteoporosis of the skull. So he needs bone and joint support and to eliminate the 10 bad foods. But, it's always better to send somebody a link to the webinar so that they can kind of understand what we're talking about rather than just do what the doctor tells you to do, right?
Okay.
Yeah, so that's how we do it, man. We just need to give him bone and joint support for a good, strong 6 months, eliminate the 10 bad foods, and keep your fingers crossed. Appreciate your call. Thank you so much. Let's see if Matthew from Canada is back. Hey, Matt, are you there yet?
Yeah, I'm here.
All right. What's happening?
I've done about 9-10 years of factory work, and I just developed carpal tunnel, which is worsening by the day right now.
Yes, that's bad, right? That's a painful thing, man.
Well, it's sore, but it's not that painful yet. But it's sore and swollen. My left is moderate. They said my right was moderate to severe.
Are you right-handed?
Yeah.
Yeah. All right. So there's if you look at the anatomy of the wrist, you can just do I think there's a Google body now where you can, they have it's like an anatomy thing, and you can do a 3D, right? So in the juncture between the forearm and the hand, there's a little tunnel through which your nerves and blood vessels go into the hand. It's called the carpal tunnel. And when that tunnel gets dried out, when it loses lubrication, just normal use of the hand will cause low-grade inflammation. Low-grade inflammation causes a scar tissue to be formed. Yeah. Scar tissue clogs up the carpal tunnel, and it's just like a snowball, rolling down the hill out of control right now. Yeah. The MD's fix for this is to open up the wrist, scrape out the scar tissue, then sew it back up and hope that it doesn't happen again. Well, that's kind of silly. That's like painting over the mold, right? Yeah. Without really fixing the source of the water intrusion that's causing the mold. It's only a matter of time until there's more mold. Yeah. Right? So from our point of view, this happens because of a deficiency in a really peculiar mineral called molybdenum. You spell that MOLYBD like David, NEUM, molybdenum. So the recommendation here to support and promote a healthy carpal tunnel is to take the 90 essential nutrients appropriate for body weight and extra plant minerals, because the plant-derived minerals have more molybdenum in them in a trace amount. So my recommendation, how much do you weigh, man?
200.
So my recommendation for you would be 2 Healthy Body Start Pack 2.0 liquid. And it's a ponderously long name. Healthy Body Start Pack 2.0 liquid. 2 of those a month, and 3 bottles of plant-derived minerals a month. 3 bottles of plant-derived minerals a month. Within 4 weeks, you should start to see a noticeable improvement. But
3 bottles? Okay. So just a Healthy Body Start Pack 2.0 liquid?
Yep.
And 3 plant minerals?
Yeah. Yeah, but in order to make this whole thing much more efficient, right, and get as much bang for your buck as you can from this program, it would be prudent for you to eliminate the 10 bad foods.
Yep.
Yeah, because if you don't do that, this is going to just work too slow.
So I don't need to worry about doing repetitive work? I shouldn't back off on that and try something else? Or
No, I wouldn't do it. I would just...
It has nothing to do with it.
Well, it's not their... I mean, there are lots of people who use their wrists all day long and they don't have carpal tunnel. Right?
I know.
So it's not the fact that you're using your wrist. It's the fact that your carpal tunnel is not lubricated anymore. It's dried up. And you need to, give it the stuff it needs to be healthy, and it'll get healthy again. I mean, 99 times out of 100, and I just made those statistics up, it bounces back. So really, you just got to nutrify the tissue, keep your fingers crossed, and see what happens.
Okay.
Does that sound good?
Yeah.
All right, man. I appreciate the phone call. And you know who to go to for help ordering the products, yeah?
Yeah. Yeah.
Okay. All right. Great. Appreciate it. Call us back in a couple of weeks with a report. I mean, good or bad, we don't screen the calls here. I'd really look forward to some feedback as to how you're progressing, and I appreciate the trust very, very much. Massachusetts is up next. Hey, my birthplace. Let's go pack the cat down by Harvard Yard. Hello, Carol from Massachusetts. Thanks for the call.
Hi, Doctor. I'm so happy to meet you. I love your show. Absolutely love it.
Hey, thanks a lot. Let's go down to Cumbies and get a grinder. What do you think?
You got a sense of humor, Joe.
What's going on?
And you've got some wonderful material on your site.
Hey, thanks, Carol. That's very kind.
Yeah, in 2006, I had uterine cancer, which I had to have a hysterectomy for. Followed after they did a CAT scan of right kidney removal. In 2011, I had a stroke, which I have a slight speech impediment. And right now, as of a few weeks ago, I was diagnosed with chronic kidney disease, stage 3.
Yeah. They want you to go on dialysis yet?
No, not yet.
Okay, so what longevity stuff are you taking already?
Well, I'm taking the hot and body pack and selenium.
Yep.
And the OsteoFX liquid.
Yep.
Anything else I should take?
Yeah, how much do you weigh?
200.
Okay, so in a perfect world, right? Well, to the program that you're already taking, I would like you to add 1 bottle of multi-EFAs.
2 ESAs?
No, 1 bottle of, multi, it's called multi-EFA.
1 bottle of EFA.
Yeah, it's called multi-EFA. M like Mary, U, L like Larry, T like Thomas, I. Multi-EFA.
Okay.
1 bottle of that and 1 bottle of Ultimate Daily Capsules. Ultimate Daily Capsules, 1 of each. Okay?
Okay.
Now, I'd like you please to watch the webinar that I did, because you're an insider, on antioxidants. I'd like you to watch the webinar that I did on antioxidants and bring yourself up to speed with what I talk about in that webinar. I want you to secure 100,000 ORAC points of antioxidants a day. And the webinar that I did on antioxidants will explain that to you, okay?
Okay.
So 1 bottle of multi-EFAs a month, 1 bottle of Ultimate Daily Capsules per month, and your goal for daily consumption of antioxidants should be 100,000 ORAC points, ORAC. And the webinar that I put together on antioxidants will explain that to you. Plus, of course, continue the discipline with everything else. And I don't even want you to be downwind of fried food, Carol. I mean, no kidding. No oil in a bottle, no 10 bad foods, like you're already doing.
Yeah, okay. And can a kidney regenerate itself?
Well, I'm not going to make promises that I can't keep, but I will tell you, I've seen lots of people under Dr. Wallach's care get off of dialysis because their kidney function improves. So if it were me, I would do this program and keep my fingers crossed. I mean, you got nothing to lose, because I'll tell you what, your medical doctor doesn't know where the breaking point is. Your medical doctor has no idea where the point of no return is. Neither do I. Your body does. You just got to give your body the right stuff, keep your fingers crossed, and see what happens. This is a relatively easy thing for the MDs to figure out, because kidney function is a pretty easy thing to, measure with blood work. So 3 months from now, you'll know whether you're getting better or you're getting worse. And, if I would roll these dice if I were you, Carol, no kidding.
Okay. So one bottle of ESI, one multi-daily capsule, and 100,000 ORAC points a day of antioxidants. On
top of what you're already doing, yes, that's correct.
Okay. Thank you, Doctor, and you keep going. You're doing a terrific job.
Hey, Carol, thanks a lot. I appreciate it. Out there in Massachusetts. Oh, folks, I could tell you some stories about Massachusetts. Yes, I could tell you some stories about good old Massachusetts. Love that state, especially in October. If you've never been to the Berkshires in October, you don't know what you're missing. I'm Dr. Peter Glidden, your steadfast advocate for health. It looks like somebody from Florida is up next. Retta, maybe? Stick around. Here we come, ladies and gentlemen, over the hill. Are we coming to the rescue? You're darn tootin' we are. Somebody has to, because the MDs have screwed it up big time. Let's go to Florida, the Sunshine State. Is it Retta from Florida? Hey, Retta, thanks for the call. You are live.
Hi, it's Rita.
Rita. Hey, Rita, how are you?
I'm doing very good. I just actually found you about a week ago and have been listening to you and then a lot of the Dr. Wallach, and so I feel like you are somebody I've been looking for a long time. So
that's what my fiancé said.
Yeah. So, gosh, I have so many things I want to talk to you about. I'm so excited that I did find you.
Well, all right, so great. We can talk about the whole kit and caboodle, but here's what I would like to do. Just to kind of set the record straight here. People like you who are like, I can just tell by what you've already said and by the tone of your voice that you're into this and you're excited about it and you're enthusiastic about it and that you're thirsty, right? That's exactly why I put together my Insider program. I put my Insider program together exactly for people like you. I have over 100 hours of archived webinars available on my website. It's a subscription-based thing, $20 a month. You can cancel at any time, and it's awesome. So I would heartily suggest for you and anybody else, quite frankly, in the listening audience who's thirsty for this type of knowledge, just become an insider. Check out the webinars that I've done, because if you like the radio show, man, you are going to love the information that's available there. We go really in-depth with it, and it's making a difference in Longevity Nation. It really is. So check it out, and let me know what you think. So let's we've got 3 minutes left here in this segment, more or less. Let's take it one thing at a time. What's first?
Okay, the first thing I guess would be weight loss. I've listened to a lot of your shows where you've addressed it, but me particularly, when I was in my late 20s, I had a hysterectomy, and I actually went out of a active lifestyle into going back to college and went into a professional career, which caused me to be sedentary. I quit smoking. I did a lot of things, and I thought that my weight gain was due to the hysterectomy, the activity and all these things. But I just kept on ballooning until about, 4 or 5 years ago, due to some financial collapse. I had health collapse. I had everything just hit at one time. Yeah. And it literally put me flat on my back. And even from there, I continued to gain weight, and I got over, 300 pounds. And I realized just through, I guess, some spiritual awakening that I didn't want to diet anymore, that there had to be something more. And so I started off on this journey of just trying to seek the truth. And so I have lost about 60 pounds, just changing my diet. And I've realized, over the course of, a number of years doing some spiritual fasting, not really doing it for the health benefit, for just fasting, I realized as I reflected back on that, man, I really felt good when I fasted. And
yeah, it's amazing, isn't it? Yeah.
And so it's really played a part because I wasn't doing gluten, I wasn't doing all these things.
Right.
So as of right now, I am gluten free. Okay.
Yep.
Now
Great.
the other top 10 things that you have there, again, these are some of them are newer things, and as you're aware, people like me get bombarded with a lot of advice from even the holistic side.
Well, but all right. So we got a minute and a half left in this segment, and I'll keep you on for the, if you can you hang out over this long break? Okay, great.
Yes.
So let me just take a Zen sword and cut right to the chase here. You're absolutely positively right, and that's why I do this radio show, because you could go to 100 health lectures this month. You could. And everybody standing up in front of the room would tell you that it's their way or the highway, but here's what we have that they don't have. We have Dr. Wallach. Dr. Wallach, the founder of Youngevity, my mentor, colleague, and friend, was in charge of $25 million of federally funded research from 1970 to 82. He did 26,000 autopsies, 10 million blood chemistries, wrote the book on medical nutrition, and then parlayed that research experience with 30-plus years of working with real patients with real disease in clinical settings. There's nobody else that has that depth and breadth of experience, and that's why, quite frankly, you should listen to what we have to say first. I'm so glad that you found us, because we've already done the heavy lifting. We've dialed it in. And, honestly, the proof of the pudding is in the eating. If you listen to this radio show long enough, you'll hear testimonials that'll bring you to tears. You stick with me, Rita, and we'll dial this in when we come back. So very glad that you finally found your way here. Hour 2 coming up, folks. I am Dr. Peter Glidden, and this is Fire Your MD Now.